Hi, and welcome back to Dr. C's Morning Minute. Glad you'd be here. I've been talking about the similarities and differences between self-stimulatory behavior and obsessive compulsive disorder and how easily they can be confused. Looking today at the differences. With the obsessiveness, children with autism tend to obsess on something favorable, something they enjoy, dinosaurs, Thomas the Train, things of that nature, or of a fear. It could be something that, a fear of the weather, fear of insects, or it may be reassurance. They ask the same question over and over again to get reassurance. People with obsessive compulsive disorder tend to obsess on something ominous. They have this intrusive thought that something bad is going to happen. The compulsive behavior with children with autism tends to be repetitive, and things of we've talked so much before about, whether it be hand flapping or toe walking, lining things up. People with obsessive compulsive disorder, the compulsive behavior is typically directly related to the intrusive thought. They may count, check, repeat, do things of that nature in a way to offset, to ward off the ominous thought so that something bad actually doesn't happen. They recognize, many, if they have a good insight, most of the time they do, people and children do have some insight in the fact that there really is no connection between the thought and the need to carry out this compulsive behavior. That if they count backwards by 10, 20 times, that it really isn't. It has no connection between their parents getting in a car accident. But nonetheless, they have this incredibly strong compulsion to do it anyway. And even though they may have some insight, it's not full insight. There's some doubt. They're not really sure, and they kind of vacillate in that respect. Sometimes not. Sometimes the insight's complete. Nonetheless, there's still the strong compulsion to do it. So you can see the dramatic difference there between the nature of the obsessive tendencies, compulsive rituals between autism and OCD, that there is some overlap, but there's stark differences in terms of what's behind them, why they're doing them, and the nature of them. That's the differences. And that's what ultimately, in the vast majority of cases, children with autism do not meet diagnostic criteria for obsessive compulsive disorder, because the differences are in how they present are quite distinct and disparate that way. So again, hopefully that helps to make that distinction. Now again, sometimes there is some overlap, and sometimes kids with autism do in fact have OCD, and it can be diagnosed. But again, more often than not so much the case. So I hope that helps to clear that up. See you next time, Dr. C's Morning Minute.